Good afternoon and welcome to the 16th webinar for the Healthy Flint Research Coordinating Center's community webinar on coronavirus. And I'm telling you, it's been an extremely exciting 16 weeks that we've been working together. And for those of you that have joined us every week, we certainly want to send a special thank you to you, even for joining us today. We know today, July 3rd, for many, they've begun celebrating the holiday, and many are off today. And for those of you that have continued to be a part of this today, even though you're qualified for vacation day, this is a real testament to your commitment of making sure that you have information that you can share with our community. On behalf of the Healthy Flint Research Center Coordinating Center, I want to welcome you. My name is Yvonne Lewis. For those of you that joined us for the first time, I'm the co-director of the Community Core for the Healthy Flint Research Coordinating Center. And as we've shared with you, the Healthy Flint Research Coordinating Center is a multi-institutional partnership led by a strong community core, our academic partners, which include Michigan State University, University of Michigan Flint, and the University of Michigan Ann Arbor. Today, we are excited about the information that we'll be able to share with you. And I hope as you're listening, even though this will be recorded, that you'll take some notes that you can share with members of the community. We've also invited those who are joining us by YouTube to have an opportunity to send in questions if you'd like. And we've asked you to call or text those questions to 810-835-2130. Again, that number is 810-835-2130, and we'll be sure to get your questions in the queue to be answered by our panel. We have a wonderful team of panelists here again today. Dr. Furholden from Michigan State University, Susan Kupel from the Health Department, Dr. Lawrence Reynolds from the City of Flint, Dr. Susan Wolford from the University of Michigan Ann Arbor, Jim Melanowski from the Genesee Health Plan, and others will be joining us today as a part of our team to give you insights. Kim Van Slyke from the Genesee County Health Department, along with Rick Sattler from Michigan State University. So it's going to be a great day for us getting this wonderful, wonderful information. We're going to begin today by hearing an update from Dr. Deborah Furholden. She is also a co-director of the Healthy Flint Research Coordinating Center. And I must remind you again that it is a partnership effort, but we have so benefited from all of you who have sent questions in regarding your concerns about not only just the coronavirus, but overall activities that are happening in our community. And so this has helped us to shape the program that we have for you today. So I want to welcome Dr. Deborah Furholden to begin sharing with us today. Morning,
Great. Good morning, Yvonne. Thank you for that. I'm going to roll through it. I really appreciate everybody coming on July 3rd. I know it's a holiday for many people and they're off from work. I want to just jump right in and talk about what the trends are nationally. You know, I hope people have been keeping up to date, but we are on the rise. If you look nationwide, you'll see that, and these data were updated as recently as July 1. We are far past now on a daily basis the number of new cases that we were at the height of the epidemic. So on July 1, we had almost 54,000 new cases of coronavirus in the US. And at our peak back in April, at the earlier part of this epidemic, the peak was around April 6th, and that was, I believe, around 35,000 cases. So you can see nationally the numbers are going up. In Michigan specifically, you know, we were doing really bad when it started as far as a, big bolus of new cases, et cetera. And that has now gone down. It started to go down. We saw a little bit of blips. And then we started the governor's phased reopening plan. And what was predictable is that as you get more people coming in contact with other people, we would start to see some kind of increase in cases. The exact degree to which we're now starting to sort of understand that. This is data from Bridge, Michigan, which comes from the Department of Health and Human Services. Is a great resource. They publish that data daily. You can see that we've now started to officially get an uptick in cases. Unlike what the CDC does, where they're just publishing raw numbers by day, we are looking at 7-day moving averages. And we now have had, a couple of weeks of being in this reopening period to be able to see what that looks like. And the take home point is that cases are also increasing in Michigan. The good news is we've got a lot more provisions that are growing in the state. And what we're doing is increasing testing. And somewhat of the good news here is that we've actually been doing more testing, especially in that sort of period post reopening. And the percentage of people who are testing positive as a function of the people who are being tested is going down. I tell everybody, take that, sort of with a grain of salt, because, I always give the example of wherever you look for cases is where you'll find them. And so I think we have done a slightly better job of trying to make sure that we have good community-wide testing and testing for people most at risk. I don't have anything that would point to, we've wasted testing. So it's a good sign that the actual, rate among people who are being exposed is going down, but it has to get tempered by the fact that the actual total number of cases per day is starting to go back up. Last thing I want to just sort of comment on, as a person who's really, really focused on the disparities, if you put it in context, Genesee County we are 6th in the state on the percentage of total cases that we represent. I'm sorry, I take that back. We're 1, 2, 3, 4, we're 5th in the state as far as cases, and we're 6th in the state as far as population. So there isn't a big, huge disparity. It's not like Genesee County broadly is overrepresented. Actually, we're about 3.9% of total cases, and we're about 4.3% of the state of Michigan. What the problem is when we get more granular and we really break it down and start to look at Flint, that's where we start to see some of the disparities. So with the takeaways that I kind of want to leave you with, and then I'm going to hand it off to our fabulous partner at the Genesee County Health Department, Suzanne Kupel, is that cases are on the rise. That's happening nationally. It's happening in all the states where they have reopened. It's happened in some of the states where they have had much less reopening. And as a function, what we're starting to see is a scaling back of some of the reopening strategies. We talked about before in the governor's 6-phase plan, we were in stage 4. Well, that's the middle of that plan. And so if cases continue to increase, we're already seeing some scaling back, even of the phase 4 activities. We might have to scale back even further. And the thing that I want to underscore is personal and public protection is important now more than ever. We don't want this thing to spiral back out of control. And the provisions also remain critical. So the provisions around testing, making sure that people have what they need to be solvent, people continuing to get, primary and preventive care, seeking treatment and care for other pre-existing or emerging health conditions. I'll stop there and hand it over to Suzanne, who'll give us a better sense of what's happening in Flint and Genesee County.
Thank you, Deborah. So yesterday, as we posted to our website, we posted 2,213 positive COVID-19 test results. And again, a reminder that this is not reflective of all the probable cases of COVID-19 that have likely been in our community because we have had limited testing, and 261 deaths. And we have seen a significant decline in the number of cases since April through last week. But this week we're averaging about 10 new cases a day. And yesterday, when we posted the information to our website, we had an increase of 14 cases. So we're all mindful that we don't want to see additional cases in our community, and that we do want everyone to practice all those preventive measures that Deborah just mentioned. Again, wearing your face mask, social distancing, washing your hands, using hand sanitizers, don't touch your face, wash frequently, touch surfaces. All of those messages are critically important, including taking care of your health, getting all your preventive screenings and immunizations as well. So the trend has been going down, but we're starting to see those numbers slowly, incrementally increase. And so it's time again to remind everybody how important it is that we take those preventive measures. I also wanted to share with you that, again, throughout this pandemic, we've had challenge with access to testing. And as some of that testing criteria loosened during the month of May, we've seen an increase in the number of people in our community who've had the access to testing that wasn't available before. So at the beginning of May, we had about 4,000 individuals that had been tested for COVID-19. And as of now, we're over 16,000. So we do have testing locations that are located in our community. And I'll remind you of those again. We have the Walmart location on Corona Road. We have Michigan Health Specialists with locations in Flint and in Burton. We have Hamilton that is running their operation at North Point and also at the fire station at the corner of Bristol and South Saginaw. And we still have the 2 Rite Aid locations, one in Forks Creek and one on Clara Road in Flint. So encourage everyone to take advantage of those locations or communicate with your personal physician and or your urgent care if you are in the need of testing. And remind everyone that COVID-19 is not going away until we have a vaccine or an appropriate treatment. So this is the time for us to really be careful and practice prevention.
Unmute. Yeah.
Thank you. Really appreciate you giving us that update. And I just really want to give a special shout out to you for your consistency, even when you've had to make some adjustments to where you were physically located to participate in the webinar, even in being in parking lots, so that you could give this information to our community. Because as we've listened to our participants in the webinar, these 3 critical issues continue to be of concern, which you've already spoken about: the reopening. What does that mean for us? The testing and even contact tracing. And I do see that Kim Van Slyght, also from the Health Department, is on the call with us today. And as another extension of the Health Department update, Kim, is there any additional information you can give to us? I know one thing we talked about was how we would stand up this support for contact tracing in our own community. So can you give us some insights on where we are with contact tracing? Kim, I think you've got to unmute yourself. Oh, there. Okay.
There we go. Can you hear me?
Yes, we can hear you now.
All right. Hallelujah. So as far as contact tracing, we are in the same place that we were last week, actually, for the past couple weeks. We are still in partnership with the state, and they are taking care of assigning our contacts as they come in and are identified from our positive case investigations here. Again, we do the positive case investigations. It goes into the database, and then the state pulls it from the database and sends those contacts out to their volunteers. We are still in process of working out the details of taking over that piece of it so that we can send the contact information out to our local volunteers with our local community partners like GHS and Genesee Health Plan. We have a meeting next week and the week after. So we just continue to move forward with that. We don't have a date, a go live date as of yet, but we are making progress.
Thank you, Kim. I just really appreciate that, because I want to be sure that our community understands that this is an ongoing process. And I'm going to use Dr. Reynolds' phrase about testing when he says it's not a one and done. Contact tracing will be with us for a long time. And so our community is really trying to get it right. So thank you for all the work that's happening behind the scenes. So Dr. Reynolds, since it's not the one and done, I'll give you a minute to open up your mic. And I love this picture that we have of you, because it really looks like you're about ready to tell us something very important, and it's really emphatic. So Dr. Reynolds, this opportunity to give us an update from the city perspective, please help us as the health advisor to the mayor. What say ye?
Well, first of all, I'd like to thank all the residents and visitors to the city of Flint who have masked up, who have done social distancing, and now I'm asking you all over the holiday to avoid large congregations of folks, uh, especially if it's over 100. And if you're not in a mask, and if you're not observing social distancing, and you're not washing your hands, because remember, you may be fine and healthy, but remember, you take it home to your family, your loved ones, even your enemies, but they give it to someone you may care about. So we must be vigilant. We don't need to go backwards, and we're depending on you. So when you get the message on social media, it's time to meet up at the flat lot or someplace. Think about it and think about how it may affect your family, not just you. Uh, so I want to share that with you. And please, adults, supervise the children who are playing with fireworks. Okay. Uh, I see I have the recommended adult immunization schedule there, so I guess that's my cue to talk about that next. And yes, we must take care of ourselves. We must exercise prevention for other conditions, other infections, and that's why immunizations are so important. Now, the list gets a little complicated. If you don't know what you have, if you don't have your record, if you're an old fossil like me, I don't have my childhood immunization record, but you do need to see what's required for adults if you're an adult. You do need to start those immunizations for your children and keep them up to date. And what I recommend to everybody, the flu vaccine that we get every year will be out in August, but you will help the pharmacist, the doctor, or whoever gives you your immunization by going now and getting up to date on what you need according to your age, because between some vaccines, there's a 6-week wait before you can get the next one. So please start now. It's early July. Get the vaccines that you're behind on out the way so that you'll be ready to get your flu vaccine. And if in 2021 we get a vaccine for coronavirus, thank God. But it does take time for it to be manufactured, distributed, and for you to develop immunity and for us to develop immunity as a community. So it goes back to where I started. Everything we do now affects the people we love and the people around us.
Dr. Reynolds, while you're at that point, can you mentioned that we need to get up to date, and you talked about old fossils or people who are older. What is the best method to find out where we are if we haven't been consistently going to one primary care over these years?
All right. Number one, uh, get your primary care doctor. Number two, for some of us who are younger, we may actually have a record that's part of the computerized record that's available in most doctors' offices, and I think maybe the pharmacies have it too. Okay, if you know absolutely nothing, if you've not been to the doctor in 10 years or you can't remember, that is something you need to communicate with the pharmacist, with your doctor, or whoever, the health department, whoever's giving those immunizations, so they can work out a plan for you. Now, if you were born after 1957, you probably didn't get all the childhood diseases that I got. So you may need a booster. Actually, I need a booster at my age. So these are almost individual conversations. Now, there's an app for that. If you go to the CDC immunization or vaccination app, you can get that on your phone or your laptop, and you can put in your age. If you know what you've had, you can put in what you've had, and that app will help you at least with part of that decision. So I recommend that. So I repeat, it's the CDC vaccine app, and it's good for iPhones and it's good for Androids.
Now, there's a couple other things we want to address, Dr. Reynolds, but while you're there, you mentioned there is a Michigan registry, which is called MICR. And I know the health department is responsible for that. but that is where all of the childhood, particularly childhood immunizations, are put. But every time now we have an immunization, we can ask the pharmacist or a physician to put that into that record. So we have an ongoing way to identify what shots or vaccinations we have had or have not had.
And I'm so proud that Michigan has that immunization registry. We used to call it the Michigan Childhood Immunization Registry, but now it is a registry for everybody. So we have been making steps forward, and you can get in that registry so you don't have to remember everything. Sometimes your hospital or your doctor also has a record of immunization. So it depends on what system you're using.
Thank you, Dr. Reynolds. I know there are a couple of other updates from the city. We had a meeting on this past or earlier this week with the Technical Advisory Committee, and there were some conversations about the water, because we know that even in the midst of COVID, we still have concerns about the water and the water system here in Flint. So can you speak a little bit to what's happened in that committee?
Oh, yes. What I tell folks is that the Flint water crisis was dress rehearsal for the COVID crisis, the COVID pandemic. We have learned to work together, and I'm so impressed at the progress that we've made. And we have resources and teams that have been continuing to work on the Flint water crisis. And one of those teams is the Blue Conduit, which is an organization that came together to use geo mapping and computer techniques to predict where lead service lines may be throughout the city. And you can access this map and pull up your own house. It has a line where you can put in your address, and it'll put a spot on where your house is, and it will tell you if you still have a lead service line, where you might have a lead service line, and it's color coded. So if you see a lime green or a light green, if you see an orange, or if you see a red, that means you need to call the city and get scheduled for a lead line replacement. And we always tell people the number to call to our public health department, our public health navigators, is 810-410-2020. For those of you who can't see the map, you can visit it on your phone or your computer at flintpipemap.org. flintpipemap.org. And believe me, the team that put this information together is very glad to get feedback from you and guide you through it. But if I can use it, most of you all will find it easy to use.
Now, Dr. Reynolds, we did in that conversation, this group is willing and has already indicated that they wanted to come on in a future webinar to give more details about this. So we appreciate you giving us this first kind of wave that people can actually go out there and begin to look, because when they come on the webinar, it would be a great opportunity to put questions in. So I just want to put a reminder out here, even now, for those of you that are listening and you want to send some questions in, their Q&A is still available, and we have our panelists who will be happy to answer those questions for you. Dr. Reynolds, there's one other thing while we're on this pipe conversation, replacement conversation. It's the opt-in, opt-out conversation.
Oh, yes. We have 371 households that have declined lead service line replacement or exploration. Now, as a pediatrician, that scares me to death, because those families are putting themselves and the people who live in the house at risk. So if you know of someone who has not had a lead service line replacement or who needs to have it replaced, please ask them to reconsider. And once again, they can call 810-410-2020 and talk to our public health navigators. Now, as many of you have heard us say before, Mayor Neely's administration has not cut off anybody's water since he took office. You should also know that he was the first mayor in the first city when this pandemic started. He said that we will restore water for people who were disconnected before I took office. So there have been 231 reconnections in the city of Flint. Now, if you know somebody who is living in a home who has no water service, please have them call 810-410-2020 and talk to our public health navigators. And the reason I say this is people may think they have particular barriers that prevent them from getting their service restored, but you need to talk to somebody at that number. Don't say no to yourself. Please call, because in order for us to wash our hands, in order for us to be properly hydrated during the summer so that we can protect ourselves and our families, we need to do this. And you keep hearing that theme over and over again. Every decision we make does not affect just us. So to date, we have had 9,603 service line replacements. We have had 25,646 service lines checked. So not everybody has a lead service line, but we want to get to everybody who does.
All right, thank you, Dr. Reynolds. He's here to continue to answer questions for you. And there may be one or two that might come your way before we're done, Dr. Reynolds, so we certainly appreciate your input today. You made a very important point when you said every decision does not only affect us, but it affects others. And I want to just share again that how important everybody's voice is, because as we've talked about even on this webinar, the information that we're seeking to respond to is for our community. We've got a global problem, but it affects us locally. And some of the information that is necessary comes from the voices of community. So the Healthy Flint Research Coordinating Center was organized for the purpose of ensuring that our community has voice in research as it's been done in our community, and how that research is really relevant to what happens here in our communities. And so we want to just take a few minutes to talk to you this afternoon about the importance of your voice in research. And Dr. Susan Wolford is a co-director of the Healthy Flint Research Coordinating Center representing University of Michigan in Ann Arbor, and she's going to share with us a few minutes about the importance of community voice in research. Dr. Wolford. Yes, now. You're still on mute, Dr. Wolford. We can't hear you.
Oh, there we go. Thank you so much, Yvonne. Had both the phone and the computer on mute. Yes, so thank you for this opportunity to share a little bit today about community voice. I think we'd all agree that one of the things that COVID-19 has done is that it's raised a large number of questions. And we all have different questions. We want to know the best treatment to take. We want to know whether a vaccine can work. We want to know whether if we get COVID, can we get it again? We want to know about special populations and how to help them, how we can keep our privacy when we're addressing contact tracing. There are people with really detailed questions about microscopic bacteria and the gut. There are all kinds of questions about our safety and other things related to COVID-19. And how do we get answers to these questions? Well, one way is through research, but it's important to think about who's asking the questions and who's answering the questions. So as many of us will know, research occurs along a continuum. On one end, we have the academic-driven research, and on the other end, the community-driven research. As we know, the academic one is typically designed and conducted by an academic researcher, compared to the community-driven one, where it involves partnerships, where there's equitable involvement in designing and answering those questions. We at the HFRCC are very focused on encouraging and promoting that community-engaged research where we can get all of the voices of the community on involved in the research. And so if we think about it that way, the reason why we think it's so important to have that community involved part is that when we are along to that side of the research, we feel like we're going to get answers and questions that are more relevant to the community, that are more likely to bring about change and impact changes in the community. Certainly, the kind of research that is conducted impacts which questions will be addressed. So if we want community priorities to be addressed, then we probably need to be towards the community engaged side of research. So I want to just mention an example that I'm involved with, which is a survey of parental perspectives that when the COVID pandemic hit, MISHA, the Michigan Institute for Clinical and Health Research, was involved in community engaged research with partners in Flint and asked, what can we do at this point? The suggestion was to do a survey about the needs of the community. And so, because I'm a pediatrician, we started out with looking at the needs of children. And so we're in the midst of this study right now, but from the very beginning, from the idea to the questions, to the design, it has been done in partnership with community. But I do want to point out something that is also very important. As I mentioned, community engaged research and research getting us answers, it's important to consider who's asking the question. So we want community asking the question, but we also want community answering the questions. And so just, we haven't finished this study yet. And when we do, we'll bring back results to share. But I wanted to just point out some of the things we know about the respondents so far to this survey. The geographic distribution, we have a little wordle there, which highlights the zip codes that are involved or where we've gotten respondents or we've received responses from. And you'll notice they're all in one area or very focused within the sort of Ann Arbor, Ypsi, Dexter kind of region, with a few in Detroit and just speckled around. And this is important because the idea is that it would be a statewide representation of the needs of communities. And you can see that we would need responses from the community across the state to be able to have findings that reflect that community voice. I just wanted to point out a couple of other things that we've seen so far, that 82% of those who've responded have a 4-year degree or more. And 12% of those who've responded make less than $50,000. And 13% of those who've responded think that somebody in their household had COVID, whether or not they were tested. So you might imagine that the stories that will be told by those who are answering the question will be quite different with this population than it might be with others. So who answers the question is important, and who answers the question is important, because that determines whose story is told, and whose story is told impacts the resources that end up being shared based on the findings and the policies that are made based on the findings. And so I think that this highlights the need for us to, at this time when there are so many studies going on and people have so many questions, I think it's important for us to think about ways to promote community voice in those projects that might make a difference, and to bring community partners and academic partners together to be able to answer important questions, so that we'll have that community voice that gives us a full spectrum rather than just a narrow view of what's happening. Thank you so much, Yvonne.
Thank you, Dr. Wolford. So we want to just encourage you as participants on the webinar to be sure that as you hear what we're doing every week, to recognize how very, very important your voice is And we really want to encourage you to give us a call at the Healthy Flint Research Coordinating Center. You can be sure that we will do our best to get you involved. You have our numbers that you can call us at any time or email us, or use our website to go on, because we really want to make sure your voices are involved. And if there's some questions that you think are not being addressed by our academic partners, we look to you to say, hey, this is one that we think a very important question for us as community that we want to have happen. Because one of the important goals of the Healthy Flint Research Coordinating Center, particularly through the work of the Community Corps, is we'd like to develop what we call a community-driven research agenda, so that there's a list of interesting topics that the community is interested in that we will certainly be able to answer for you. So I want to go now to where there's some community partners who are on the line, and we want to make sure that we hear from our community partners today again. I want to remind you again, I saw some questions in the Q&A. If you would please continue to put those questions in. Our panelists are here to respond to those questions that you might have. Our community partner on today, Jim Melanowski, as you're preparing to unmute your mic, we want to hear more about what's happening with the Genesee Health Plan and how the health plan is preparing to make sure that the community members have health coverage and a medical home. Jim.
Well, hello, Yvonne. Can you hear me okay?
I can hear you, yes.
All right. Well, it's good to be on here. And yeah, we're still assisting people. And it is critical, as we heard from Dr. Reynolds and we heard from the panelists last week from the hospitals, that it's so important for people to have healthcare coverage, to be connected to primary care during this time, and as they're trying to maintain their health and get healthy. So it's important, and that's what we do at the Genesee Health Plan. We assist people in making sure that they have healthcare covered, whether it's on the Genesee Health Plan or on Medicaid or on Medicare. So our staff is out there and can help people, and all they have to do is give us a call. And so I'm not sure if our number is going to be up there, but 810-232-7740. One of the things that we didn't talk about last week that I wanted to make sure, we talked about making sure we went for our primary care visits, and we talked today about immunizations that are so important. Let's not forget about our dental and our oral health care. And, dentists were closed there for a while, and now's the time to get reconnected with our dentist if we missed an appointment. Even those 6-month cleanings are so valuable in making sure we maintain our oral health. So now's the time to contact them to get in and make sure that people get their appointments. The number 2 reason why our health plan members go to the emergency room has been for oral health issues, infections, and so forth. So it's a very important for people to maintain their oral health so that their medical health, their overall health is effective, especially if you're trying to fight off any virus or anything, that the second wave or whatever that might come in the future. So just want to emphasize that, and just kind of a preview of wanting to make sure people get those immunizations, as Dr. Reynolds talked about. The health plan has had an annual flu shot drive. People can actually come to our building and either drive in or get immunizations through the health department who are there. And that MICR, you were talking about that registry. And when the health department's there, they can look up whether they have on record if you've had your shots or your boosters. I know I did that once, and I was amazed about the information that's in there. And I was able to get a booster on some of the things that I was behind in. And it's a great system. So just kind of let people know that we're working on organizing what the end of summer, fall is going to look like to make sure we have flu shots and other immunizations out there. And I know you had that up for us, Yvonne, and maybe sometime we can talk about that.
Yeah, and Jim, while you're at that point, you raised the importance of the partnerships as well, because we don't do this work alone at the Genesee Health Plan. There are a number of partners, and the issue of even having people signing up for Medicaid, that's something that's very important to us, that we help of course, enroll people, and I say we at the GMC Health Plan, all of us are partners, so I'm including everybody, enroll in the health plan, but also any other insurance that they may be eligible for.
Right. Medicaid's a good one, for example, and a lot of people who became unemployed during this pandemic were able to get on Healthy Michigan, the expanded Medicaid coverage, and so that's been great. But we want to make sure people also keep it. So there's always a re-enrollment process, and we can help people with that, or DHHS can help with that, or Hamilton, or the Health Coalition staff. There's a lot of partners, as you said, that can help people with that. So if people are on Medicaid and they don't know how to use it or keep it, this might be the first time that they've ever been on something like that, those are some of the partner organizations that can help with that, because there's dental, there's vision, there's mental health, there's medical, there's just so much that are offered under those Medicaid health plans that people should take advantage of and use that coverage as well. Not just have it, not just keep it, but also to use it.
Thank you, Jim. And we will be talking about this more. You mentioned our drive-through clinic. We've already began conversations with the health department. Maybe we'll have to do multiples of those. This year with COVID, it has created a new environment for all of our partners, and we're really trying to work together to figure out how to best meet the needs of our community. So we encourage you to stay tuned.
That's a teaser. Yes.
There's more to come.
Yeah.
One of our partners, Gary Jones, was not able to be with us today, and he would always provide us updates from the state of Michigan. And the state of Michigan. And so, I thank you, Dr. Deborah. My internet is being very unstable today. But Gary would be reminding us right now of some of the very important things that the governor is doing. And as Dr. Deborah mentioned earlier, she's kind of slowed down the phase of our reopening because, as Suzanne mentioned, we have seen a little bit of an uptick in the number of persons that are testing positive. But we do want to remind you that she extended the suspension of evictions through July 15th. And it's important for those who are having some challenges with their rent or paying their mortgages, that they don't wait until they get into deep problems, but they can talk now with representatives to try to get some assistance. There is an eviction diversion plan for renters who are seeking fast rental assistance or a more manageable payment plan. This is in place until July 15th. That stay of evictions is in place until July 15th, but this additional support for this diversion plan has also been created by the governor. So we want to encourage you to actually get in touch with the representatives at the state to make sure that you can stay in your home. This is really, it's like having a medical home. You also need to be able to stay in your home. So please, let's continue to keep that in mind. The other update we wanted to bring you from a community partner, last week we talked about this. With all the things that are going on in this environment, many of us are feeling some additional stressors. And as Jim mentioned before, if you've never been on Medicaid or public assistance, you might find yourself being in need of that, but that may bring some complications for you in terms of how you feel about that. And so there's some current support groups that our partner organizations are doing. There's one that will be on July 16th for adults. And then there's a session for youth that'll be on July 9th and July 23rd. We want to encourage you. These are Zoom meetings, and you can call in, and the information is on the screen. But for those of you that are listening and may not be able to see it, I want to give you the number that you can join in on for this call. The number for the support group is 1-646-876-9923. 646, because it's a long distance.
That's the, you know what, my friend, that is actually to call into the Zoom.
Okay.
So let's, do you mind if I just jump in and I'll say the Flint Women's Study is the sponsor, and they are on Facebook, and you can look them up at Flint Women's Study. Perfect. And if you want to get email information, you email FLEES, FLEES, MOR at MSU.edu. Flees, FLEES MOR at MSU.edu.
Thank you, Dr. Deborah. All
Yes,
right.
ma'am. Always, always.
That's teamwork, teamwork, teamwork. So we want you to continue. Now there are some updates we want to provide for you. We know we're going into the holiday weekend, and we can't emphasize this enough. And I will ask Dr. Deborah to chime in a little bit on this as well. And Dr. Reynolds, we've talked to our listeners for the last few weeks about maintaining personal protection during this COVID reopening. And I think this will be something that'll be with us for a long time. The first thing we've talked about is not anything new. We've been talking about this for years. We learned about this for those of us that are older in kindergarten. Wash your hands. But we realized this was racist because we were telling them to use hand sanitizers, and many of them were not washing their hands. So, but today, wash your hands, use hand sanitizers. And Dr. Deborah, you gave us an example a couple of weeks ago about the use of gloves and why that wasn't necessarily always the right thing to do. So can you reemphasize while we're here talking about the washing of hands, why it's important to also use a hand sanitizer more frequently than necessarily using gloves?
Well, because the problem is if you have on gloves, then anything that you touch with those gloves, you run the potential of cross-contamination. The upside of gloves is I know when I have on gloves, I'm less likely to touch my face with the gloves on. So it's a good reminder for me to not touch my face, but it doesn't let you off the hook from still being mindful of things you touch, because you can touch something. You know, the person before you comes and they sneeze on the ATM, you know, not the ATM, the little point of sale machine. You touch that with your gloved hand, and then that gloved hand now potentially has the virus on it. So, and then people were doing things that we don't recommend, like sanitizing the gloves. You know, people are just mindful when they're out and when they touch things. If they keep their hands off their face and don't touch their face, don't rub their eyes, and regularly wash their hands. And some people have gone over. I've heard people say, I wash my hands 60, 70 times a day. Well, that's excessive. That's really only needed when you're out, and you should be sanitizing your hands with 60% alcohol hand sanitizer, as Suzanne Kupel keeps telling us over and over and over. People, you will do better with hand hygiene to wash your hands and sanitize your hands.
And so that gets us to the idea of personal protective equipment. And so we have a couple of minutes to tease this out a little bit too. So we talked about gloves as being personal protective equipment, but who really needs to be utilizing the personal protective equipment?
Everybody does. Everybody, when they're out, should be masked up. Okay. And the protective equipment is, again, it is to protect, you know, have a barrier in between others and you, but it is primarily to really protect, to protect others from you. It does protect you from them as well, right? Because the likelihood if something, you know, some aerosol or some spray is around and you've got your mouth and your nose covered, the likelihood that you'll inhale that is greatly reduced. So the mask is two-way protection. It protects you from others and it protects them from you.
Okay. We also want to continue physical distancing. And I think Dr. Reynolds mentioned that during the holidays. And Doctor, if you want to just, I see your mic is off, so I know you're ready to chime in here. Let's practice physical and social distancing.
Oh, most definitely. You know, as we loosen up on the restrictions, social distancing and wearing a mask and washing your hands are still the essentials. And then in this phase, avoiding groups of more than 10 people. If you're having a barbecue, if you're really doing it right, you only deal with the people in your household. Don't involve Lottie Dottie, everybody, and Cousin Willie from across town. You really have to restrict your circle of contacts during this phase of the pandemic. And I want to reiterate, we are in the mid phase. We're not halfway done and we're not halfway there because we don't know how long this is going to last, because we don't have the experience with this virus. So the other warning is, if we say this works best this month, we may get more information that next month will say, here's something else you need to do. So
Right.
please start with the basics and build. But I just got a news blast from Cheryl Thompson, Deputy Director of the Department of Health and Human Services, about her favorite city, which is Flint, Michigan. She said that there will be testing by the National Guard July 9th and 10th
Awesome.
at Shiloh,
Awesome.
July 17th and 18th at Word of Life, and July 24th through 25th in Beecher. And I'm sure that my colleagues at the health department will be posting this before the weekend is out. But this is good news. So
That's
if you
great news.
if you've been around someone who has had COVID, if you have to leave the house to go to work, if you think you have symptoms, go ahead and get tested. And the reason we've opened these things so wide is because many people who are infected with the virus are asymptomatic. They don't have any signs or symptoms or problems. They feel fine, and it's good to get tested. And as we build this testing capacity, we'll do what is called surveillance. We'll be able to get a snapshot of where our community is today and decide how we make our plans to go to the next phase. But it's also to identify areas that become hotspots. So please take advantage of this testing. And believe me, I've had the National Guard test me, and they were so quick and proficient in what they did. It was done before I could even say, when are you going to start?
Dr. Riddles, thank you so much. And this is important. We're sharing, and I know many people may say we're repeating, but repetition is very, very important because we're learning something new in the process every time. The other important thing here when we talk about the distancing, and maybe you're going to be out and about, if you're around people that you know, if someone in that little party does test positive, it's easy for them to contact you so that they can help you be safer. So that's the other important thing about watching who you're around. We want to encourage us to continue to boost our immune systems. And we're going to have this holiday weekend. Let's still eat good, eat some fruits and vegetables, and make sure that we're doing what's necessary to boost our immune system. We want to regularly clean and touch surfaces. I know we talked about this a little bit too a couple of weeks ago, getting ready for, now it's almost a month ago, getting ready for Memorial Day. And the question was asked about preparing. And so it was make sure those utensils that you're using outside are still clean and ready to be used, but let's make sure we clean all the surfaces. We want to stay abreast of current information and make good choices. And we just got information fresh off the press about testing sites that are going to be coming up in a couple of weeks. So again, it is get tested on a regular basis, and that does depend upon your exposure. If you haven't been out and about in 14 days and you're fine, but if you're out and about interacting with others, we still want to encourage you to get tested. As we can move forward today, we have one more really, really important thing we want to share with you. And I am going to hand this off. We can go to the next slide, Tricia. I'm going to hand this off to Dr. Deborah again, and those who have some really for the 4th of July weekend. Here's what we'd like you to keep in mind. Dr.
So great. And so you kind of already went through the protocols. So really, we encourage everybody, and I'm asking everybody on the webinar to be, ambassadors in the campaign, because you all have way more influence with your friends and family than the people on this webinar. And so really stay safe and honor the protocols. We got to get counted, and the census is our way to do that. So if you haven't personally, make sure that you complete the census for yourself and your household. And if you have done it, if you're going to be around people, if you're going to be interacting with people, if you're going to have a Zoom, celebration. We just did my daughter's high school graduation. It was all by Zoom, and it was awesome. Encourage others to complete their census. Sometimes people need help. And if you have a laptop or a smartphone and you're able to do that and assist somebody, do that. Make sure you complete your census, and that the others that and come in contact with complete theirs. And this is also an ideal opportunity to underscore the need to register to vote. And again, you might say, well, I'm registered. Yeah, but if you're registered, Are the people around you registered? One of my favorite things that I watch for encouragement and inspiration is Reverend Jesse Jackson's David and Goliath speech. And it's so great. And he talks about how David defeated Goliath with nothing more than a slingshot and a God biscuit, which is a rock. And he makes the analogy that our votes are our rocks. And we got so many of them just lying on the ground. We leave so many votes just lying on the ground. So I'm gonna say what Reverend Jackson said, pick up your rock, David, pick up your rock. So register to vote. And if you are, then encourage those around you to register.
I want to bring Dr. Reynolds back in one more time, because I know that the city, working along with the mayor, has a complete count committee. And that committee is working to ensure that everyone in Flint gets counted. We want all of Genesee County, but Flint, the numbers show, and Dr. Susan Wolford talked about some numbers earlier, but the numbers show that in certain zip code areas and wards, we are not represented. We're not counted. And if we don't get counted, that could have a terrible impact on the health of our financial situation for our community. So, Dr. just want to give you a couple minutes.
I'm not
to
the
talk
expert
about.
on the census, but I will tell you this. If we don't get counted, we don't get dollars for schools, we don't get dollars for Medicaid, we don't get dollars for roads. There are so many things that we do not get if we don't vote. I mean, if we don't vote, yes, and if we're not in the census. And you only have a chance to do this every 10 years. So if you miss this year, you have done a number on us for the next 9 years. So please get on it. And who I would really recommend is Tony Turner, who is working with the mayor on the census. And you all may have heard from him in previous counts, because I think he's on his second or third census now. But he's an excellent person to bring on, because the census and being registered to vote and voting determine what happens to us for the term of the people we vote for, but for the census, the next 10 years. So don't complain. Get out there and register to vote and do your census form. You can do it on the phone, you can do it by computer, and Tony Turner would be the expert on that. I stay in my lane.
Yeah, thank you. But you shared exactly what I thought was important, Dr. Reynolds, that there are a number of things that we would miss out on if we don't get this count done. And so we will look forward to having Tony Turner come and talk a little bit more. Someone asked a question, this is for everybody, about the census. There was some delay because they have individuals that will come out, and they call them enumerators, that go door to door to places when people have not homes, when people have not completed the census. Those enumerators were not able to go out because of COVID virus. So there has been an extension on census. The actual census day was April 1, but that has been extended. So just if you have not done it, you still have time. And I noticed that one of the representatives from the one of the support group was on the line. I don't know if we can unmute Bishop Jefferson. Dr. Deborah, is that possible? To just share a word about the support group?
She's able to speak.
Bishop Jefferson? Okay, you may have to unmute yourself. Well, we'll provide that opportunity in our next webinar, because we certainly want you to know that we appreciate your participation every week. And for those of you that have joined us today, thank you for taking this time to learn more from the webinar we provided for you today, that you will then share with your family and friends during this holiday weekend. We want you to stay connected with us, and the information, just Healthy Flint, please subscribe to our YouTube channel. That'll help it be readily available to you. You can like us on Facebook and email your questions to us at any time. If in fact you have a question that has not been answered in the queue today, our panelists will be on just for a few more minutes to respond to those questions. But let me thank all of you today, our panelists. You're always absolutely wonderful, and we thank you. There is a pop-up evaluation immediately following the webinar that we would like you to complete. Those of you that are listening, every one of you, when you complete those webinars, they help guide us. I want to just give you a tip for next week, July 10th. Many questions about the reopening of our schools. And I want to let you know we will have representatives from the Genesee Intermediate School District as well as the Flint Community Schools to talk about the reopening of our schools. And so again, thank you for tuning in and being a part of our webinar today. And we'll look forward to you being here with us next Friday, July 10th, for the next community webinar on coronavirus. Thank you.